If you or a loved one have been diagnosed with hypophosphatasia, or HPP, you may have a lot of questions. You are not alone. And over the next few minutes, we hope that this informative video will help to provide some answers to those questions. What is HPP, and who does it impact? HPP is a rare inherited metabolic disorder that affects the body's ability to form bone and may also affect other areas of the body. Leading to a wide variety of possible symptoms, HPP can affect people of any sex, race, and age. How does HPP occur? Those living with HPP were born with a change in the ALPL gene, which was passed down from one or both of their parents. Inheritance happens via one of two patterns: autosomal recessive, which requires 2 copies of the changed gene, or autosomal dominant, which requires only 1 copy. Having a change in the ALPL gene leads to persistently low levels of an important enzyme called alkaline phosphatase, or ALP. ALP helps to free phosphate in the body so that it can combine with calcium to create the building blocks for healthy, strong bones. Without sufficient ALP, weak or soft bones may develop. How is HPP diagnosed? Because of the wide range of possible symptoms, the severity you or your loved one experienced, or some healthcare professionals being less familiar with HPP since it is a rare disease, the road to HPP diagnosis may have been long and difficult. A routine blood test can show whether the ALP level is low for a person's age and sex. If one or more symptoms of HPP were present, and if other causes of a persistently low level of ALP were ruled out, your or your loved one's doctor may have diagnosed HPP. Finally, having a diagnosis may feel validating, revealing the reason behind symptoms that may have been accepted over time as being normal. What are the symptoms of HPP? Though HPP is a bone disease, it can affect other parts of the body. Symptoms such as broken bones, premature tooth loss, and bone, muscle, or joint pain may develop. Because symptoms can vary by age of onset, HPP is often classified according to the age when symptoms first develop or become noticeable. The prenatal form of disease is diagnosed before birth, when ultrasound or other imaging shows that the skeleton isn't forming properly in the womb. It is one of the most severe forms of HPP. Affected newborns and infants may develop an abnormally shaped head or chest and have issues with feeding and gaining weight. In severe cases, breathing difficulties or seizures may be present. Children with HPP may experience early tooth loss with the root intact, poor growth, muscle weakness, muscle or bone pain, and developmental delays. Affected adults often present with muscle or bone pain, fatigue, and recurrent fractures that may be slow to heal. What is the impact of an HPP diagnosis? It's important to realize that HPP may progress, meaning that symptoms such as recurrent fractures, pain, weakness, and fatigue could get worse over the course of one's lifetime. HPP may also impact quality of life, with issues such as missed motor milestones during childhood, mobility difficulties that require assistive devices, joblessness, or missed days from school or work. Share symptoms of HPP and their impact on quality of life with you or your loved one's doctor. Doing so may lead to feeling more empowered and also give the healthcare team more information to help manage you or your loved one's symptoms. While a diagnosis of HPP may feel overwhelming, there is support and you are not alone. For more information on HPP, visit www.hypophosphatasia.com. For more information about HPP and additional support, please call 1-888-765-4747 to be connected to an Alexion case manager who can provide education and support.